In this chapter, we will discuss the maternal physiological response to becoming a mother. Family is a unit where the addition of a new member affects the unit as a whole. The nurse should assess for outward signs of positive bonding. Attachment is the process whereby a parent and newborn come to love and accept each other. We can see these things beginning in the infant as it displays signals such as crying, smiling, and cooing, engaging parents. Phases of maternal postpartum adjustment include what's known as taking in, which occurs in the first 24 hours. During that stage, the mother is asking to be taken care of so that later she can take care of her baby. The next stage is what's called taking hold. And in that stage, the mom is setting, I'm getting ready to work now, and preparing for the last stage, which is called interdependent. This is where the mom can care for herself and the newborn with little to no help. The next slide talks about maternal and family integration. Becoming a parent is a difficult time of instability and unknown factors. Parents should be observed for actions indicating the formation of maternal paternal newborn bonds. One such interaction is called claiming. Claiming is the process by which the mother recognizes family likenesses. An example of this is, look, honey, she has your cleft chin or your dimples. The baby is then identified as a new member in the family. Another communication noted between newborns and parents includes utilizing the senses such as touch and eye contact. The mother may demonstrate what is called the in-face position, which is defined as mutual gazing. The patient holds the baby in the Madonna position and engages in mutual gazing. Fathers also demonstrate positive attachment signs like engrossment. This action is defined as the father's absorption, preoccupation, and interest in the newborn. Sibling reactions are affected by the changes this new family member has made, and rivalry is common due to jealousy. Preparatory classes may assist with this transition by the sibling. Presenting the sibling with a gift when they first meet the new baby, look, your baby sister bought this for you, can assist with that transition. There are also barriers to the bonding process, such as high risk or complicated birth where the baby is taken to the NICU, or poor social support. Nursing assessment includes identifying maladaptation danger signals such as avoiding eye contact with the newborn, any negative comments verbalized to or about the baby, identifying negative characteristics about the baby, unrealistic expectations of the infant, or bothered by the infant's cry. Vulnerable populations, such as teenage pregnancy, do occur. Maternal age may impact the transitioning process into motherhood. There are two distinct age groups that may have a different set of needs with regard to motherhood transition. The first set are teen pregnancies, and the second is what is termed advanced maternal age patients. Those are over 35 years old for a first time pregnancy. Pregnant teens are a unique group based on their developmental age. Childhood theorists define adolescence as a time for the teen to find themselves. It is a time of self exploration, seeking out their fit into the world. The teen may have difficulty with parenting due to their own unmet developmental needs. These unmet milestones are complicated with the addition of newborn care. Teens have difficulty making good life choices. Some teens are ill equipped to make informed choices for their newborns. However, after they give birth, they are technically what's called an emancipated minor, which gives them the right to not only make choices for themselves but also for their newborns. You can see how this could become complicated. Teen pregnancies are associated with medical issues such as anemia and preeclampsia, cephalopelvic disproportion, sexually transmitted diseases, intrauterine growth retardation, ineffective parenting, and intimate partner abuse. While nursing management of all patients includes establishing a feeling of trust and rapport, engaging the teen is particularly important and can be achieved by doing a couple of things like avoiding authoritative or a punitive approach. More often, it's better to set the stage for as a more information sharing environment. Praise them for health maintenance activities and allow their support person at all times. Lots of education both during the pregnancy and after. Teens are usually prone to meals that lack nutrition. Teens are also likely to emulate their peer group that may include poor lifestyle choices like smoking, alcohol, and illegal drug use. Nursing care for the teen mother should include connecting the family to the outreach, community resources, and education about contraceptive choices. The pregnant woman over 35 also has her own set of unique circumstances. We have seen a rise in first-time pregnancies occurring after age 35. Reasons for this phenomenon include postponing pregnancy for career advancement and infertility issues and methods. Studies have demonstrated that advanced maternal primipara is at greater risk for medical issues such as a higher risk of Down syndrome, and the AMA patient may require more laboratory and diagnostic testing. Their risk factors include all of the normal plus chronic health issues with the aging process, such as chronic hypertension and type 2 diabetes. As nurses, we need to assess social, genetic, and environmental factors. Older mothers may have less family and smaller support groups. They are also less likely to live close to family members. Work and career issues are always a source of stress. Nursing management includes, again, lots of teaching and easing maternal fears. It is important to explain warning signs to be aware of. Most patients in this age group have the need for some level of control. Family planning or planning for future pregnancies. I'm not going to talk too much about this slide. This slide outlines the immunizations that are commonly found on a postpartum unit. But I have included a page number here that I think if you refer back to your textbook, that's going to nicely explain everything that's needed to know on this particular slide. So once again, family planning includes teaching and options. Included in the postpartum period is the ability to plan for future pregnancies. Along with the physical organs returning to the pre-pregnancy state, sexual activity may also be resumed. It is advised permissible when the episiotomy is healed and lochia has stopped. With that choice, the new family will need to address how they plan for their future pregnancies. While many options are now readily available, research tells us that still nearly half of all pregnancies are not planned. This slide outlines some choices with regard to contraception that I will cover in the next couple of slides. In all my years as a bedside nurse, we used to say, no one goes home until we talk about contraception. Contraception, the first one that we're going to talk about is the hormonal based. I'm not going to go into great depth about these options. I think your textbook does a great job of describing the particulars about each type of device or process. Hormonal contraception options are frequently used, although there are some specific groups of women that should not use this method. For instance, hormonal options are not good for smokers if over 35. It is not good for those with a history of cardiac issues, thrombolytic disorders, liver function problems, just to name a few. And certain medications, if taken in conjunction with oral contraceptives, will decrease its effectiveness. Women who choose this type of contraception, teaching is imperative. Lack of compliance with regard to dosing or missed doses impacts the effectiveness of the product. Because of the wide variety of options that exist in the marketplace today, it is recommended that the patient be advised to consult the manufacturer's brochure for special dosing instructions. Combined estrogen and progesterone products include oral contraceptives, transdermal, vaginal ring, injectables, and implantables. Some particulars for hormonal contraceptives include, with the oral doses, what to do if there is a missed dose, taken at the same time of the day, and when taken correctly, almost 100% accuracy. Decreased effectiveness when combined with antibiotics or some over-the-counter drugs. And missed doses, which is user error, also can impact its accuracy. Transdermal patches need to be applied once a week, but not in the same place. Implantable options are good for 3 years. Injectable options need special treatment in that they should not be massaged after the injection. It will hasten the absorption and decrease effectiveness. Emergency contraception, which is also known as Plan B, is more available in today's market than it was even a couple of years ago. Mechanical barriers, there's both female and male, are used by those that do not want to adhere to a strict program of taking pills or add hormones into their body. One commonly used contraceptive method is the intrauterine device. 2 types are available in the United States, the copper T and the Mirena. The IUDs work by immobilizing sperm and creating a low-dose intrametrial inflammation, preventing implantation. A disadvantage to this type is increased bleeding and cramping. The second type that I'm going to talk about is called a diaphragm, and it just about includes what's also called a cervical cap. This type has some significant disadvantages in that there is a need for frequent resizing. There's lots and lots of training. The product needs inspection for defects prior to insertion, and it is necessary to leave it in place at least 6 hours after intercourse to ensure optimal effectiveness. Certain products may require the addition of a spermicidal chemical. The next one that I'm going to talk about is condoms. Condoms, again, are quite common. While both male and female condoms are available, most condoms marketed are the male version. There are essentially 3 types of male condoms: latex, rubber, and natural. One of the advantages of properly used condoms is STD protection, except for the natural version which does not have any STD protection. Some manufacturers may also recommend the use of spermicidal chemicals in conjunction with their product. Fourth, a commonly used spermicidal agent is non-oxano 1,9. It works by destroying sperm flagella and affects the sperm cell membrane. It is easily applied and economical. The next option is called fertility awareness. Fertility awareness is defined as methods used to identify fertile days in the menstrual cycle and then practice abstinence on those dates. A variety of methods are available, such as calendar charting, basal body temperature charting, and cervical mucus methods, which is known as Billings or ovulation. This birth control method, is most natural, and that is its greatest advantage. There are no costs, no chemicals or hormones. Its disadvantage, as you can imagine, is compliance to be effective. Patients must learn lots of timing and training. It decreases spontaneity. It requires strict record keeping, and it is decreased effectiveness with irregular menstruation. And effectiveness is impacted by patient adherence to a strict program. Sterilization has been considered the most permanent form of birth control and should be utilized for those that have decided not to have future pregnancies. Both male and female surgery share some commonalities, such as the procedure itself is done either by cutting and or ligating the egg and sperm pathway, preventing fertilization. The nursing care and patient education and risks are essentially the same for both men and women. Post-operatively, we teach the patient the signs and symptoms of infection, fluid and electrolyte balance, complications that occur related to hemorrhage, and how to control discomfort. Both procedures are reversible through tubal reconstruction, but this is a costly option. Both surgeries can also be done outpatient. Temporary supportive contraceptive supplementation is recommended for male sterilization until the lab test can confirm success of the procedure. Other practices that are used for birth control are abstinence, withdrawal, and breastfeeding. What's interesting about this slide is that other practices that either work 100% of the time, as is the case with abstinence, or contraceptive methods that are most unreliable, such as coitus interruptus and breastfeeding, are all on the same slide. Breastfeeding as a form of birth control is at the very least considered risky. The pathophysiology for this option relates to the baby suckling, which increases prolactin, which inhibits estrogen and suppresses ovulation. Only if breastfeeding is exclusively done regularly and long enough in time will this practice work. I'd like to talk a little bit about the Safe Delivery Law. The Safe Delivery Law allows a mother to surrender her child under 3 years old to a civil employee at their place of employment. It is important to note that the employee must be in uniform and must be in their place of employment. I hope this has helped you, and we'll be talking to you again.